Okay, today we're going to be doing the abdominal inspection. So first you're going to inspect the abdomen, looking for any pulsations. You would see any kind of respiratory distress by looking at the accessory muscle use. Um, you could see sometimes the peristalsis waves in the abdomen from the gut movement. I don't see any of that today. Next, I would do auscultation. However, for the purposes of this video, I do not have my stethoscope with me, but I would be listening to all four quadrants of the belly. I would also be listening to the aorta and the fem sites to hear any kind of bruits or any vascular sounds. I could also listen to the liver up in the right upper quadrant and the spleen in the left upper quadrant if I was auscultating. Next, I'm going to go ahead and percuss the abdomen and see if we hear any kind of, whether we hear tympany or dullness. If we heard dullness, that would indicate, enlarged organs, either with the liver or the spleen. So I'm going to go ahead and just percuss at this point. And I'm hearing tympany now, which is normal for the abdomen. And we're going to go ahead and percuss and mark the liver borders. I'm going to start down by the umbilicus at the midclavicular line and work my way up until I hear dullness, which will indicate the border of the liver. Okay, I hear dullness at this point, and so then I'm going to go up to the ribs and percuss in between the ribs to find the other border of the liver. Okay, and I hear dullness here. So my liver margins are right about here. And then for the spleen, I'm gonna also percuss to feel the spleen. I should not hear any dullness if I or even feel the spleen on palpation. If you do, that would indicate some enlarged spleen or splenomegaly. I'm still hearing tympany. Go ahead and next is going to be palpation. I'm going to start with light palpation to get the patient used to my touch, and then go in for a deeper palpation afterwards. So I'm going to push on your tummy, okay? Any pain or tenderness?
No.
Okay. All right. So after doing some light palpation, I'm going to go in and do a little bit deeper palpation, see if I can feel any of the structures. When palpating for the liver, you would do a deeper palpation up into the right upper quadrant, up underneath the ribs. Sometimes you could have the patient take a deep breath, and as the patient takes a deep breath, that liver can move down and you would actually feel the liver with the tips of your fingers. You could also do a hook maneuver, which would be hooking your fingers up underneath the ribs that would allow you to feel for the liver. Take a deep breath in for me. And I can feel your liver right there. Okay, now for the spleen, same thing. You shouldn't feel the spleen. If you do, again, it indicates some enlargement there. But on this one, go ahead and take a deep breath in for me. Okay, thank you. And then feeling deeper palpation on the left, you would feel possibly the colon, might feel some tenderness there. Do you feel any tenderness with that? Okay, good. Now, if I were assessing for cholecystitis, you would do look for a positive Murphy's sign, which would be upon palpation up by that liver border where the gallbladder is. You would palpate on that left upper or right upper quadrant, and if the patient halts his inspiration upon palpation because of pain, that would indicate a positive Murphy's sign, which would therefore indicate some cholecystitis. Okay, go ahead and take a deep breath in for me. Clearly you don't have any pain there because you do not have cholecystitis. Next, if we were checking for appendicitis, we could actually palpate McBurney's point. We would check for some rebound tenderness in that right middle lower quadrant. You could also check Rossving's sign on the left middle lower quadrant, which would, if positive, it would elicit pain by McBurney's point on the right middle lower quadrant. There are also some tests you could do with the legs that would indicate some peritoneal inflammation, one of which would be, go ahead and cross your legs for me. Now push up on my hand with your knee. Okay, perfect. Now bend your leg. And it's called the obturator sign. You could take their knee and rotate the knee around, and if it indicated, if they were to receive pain in the abdomen, it could indicate some peritoneal inflammation. So I'm going to just go ahead and feel any pain with that? No. Okay, perfect. Okay, thank you very much. Okay, thank you.